I'm Joe Caldwell. I'm director of the Community Living Policy Center at Brandeis University. And I was one of the co-leads of the living arrangements and support strand at the recent University of Minnesota State of the Science Conference. And that was along with my colleagues, Sherry Larson from University of Minnesota and Greg Robinson from the Autistic Self-Advocacy Network. And on behalf of our work group, I'm going to summarize some of our key findings. And we've organized these by three questions. Where have we been? Where are we now? And where are we going? So first, I'd like to talk about where we've been. And over the past several decades, as many of you know, we've made a great deal of progress shifting away from large institutional settings towards more home and community-based services. It's been true for all people with disabilities, but particularly true for people with intellectual and developmental disabilities. And the University of Minnesota, they've tracked this progress through their Residential Information Systems Project, or RISC project. And just to highlight a few statistics, the number of people with intellectual and developmental disabilities in state institutions, that peaked in the late 60s at around 200,000 individuals. And today, the good news is only a little more than about 16,200 individuals remain in state institutions. And in fact, 17 states and the District of Columbia, they've closed all their large state-run facilities for people with intellectual and developmental disabilities. And nationally, the number of people in other institutions called intermediate care facilities for people with intellectual and developmental disabilities, that's also declined significantly. And we know more people are living in smaller settings of 3 people or less, or with host or foster families. And so the reality today is most people with developmental disabilities, whether they get funded supports or not, they're living at home with family members throughout their lives. And actually, about 59% of people that are receiving services from the IDD service system, they're actually living at home with family. So those are some things we know. And where are we at now? Well, surprisingly, we actually know very little about racial ethnic disparities for people with intellectual and developmental disabilities. The University of Minnesota RISC project, currently that project doesn't collect race and ethnicity on individuals in different types of settings. There's a strong desire to collect this information in the future, but we know that some states are going to have difficulty reporting that data because some states don't adequately collect race and ethnicity data. There's high levels of missing data in many states, making it really difficult and impossible to examine some of the disparities that might exist. And that's a real policy issue that we need to address in many states and also at the national level. But we do know some things about racial ethnic disparities. We know that the rates of disability, including intellectual and developmental disabilities, are actually higher among many racial ethnic minority populations. And we do know that disparities in access to formal services and supports do exist. And some of the best research that's been done on this is by Charlene Harrington and her colleagues that studied individuals in California. And what they found was compared to white individuals, racial ethnic minorities were less likely to be receiving IDD services. And when they were receiving less services. We also know some things from the National Core Indicators, and that's a survey of people with intellectual and developmental disabilities that are receiving services. And some of the research from that survey has found that in comparison to whites, Black individuals with IDD were more likely to report wanting more opportunities to be involved in the community and more opportunities for community employment. They actually found disparities in community employment and also health, including routine vaccinations. So lastly, where are we going, or where should we go? Well, let me highlight some of the broad research directions our work group recommended. So we came up with 5 research questions. First, we need to know, what are the characteristics of people by the places that they live in terms of their race, ethnicity, and other identities. So we need to understand, what disparities they face in access and utilization of services and supports. The second question we came up with is, what impact do household and neighborhood characteristics have on support needs and outcomes? And so by this, we mean things like characteristics of the neighborhood and households in terms of poverty, access to transportation, access to food. So these are a lot of times talked about as social determinants of health. The third question we came up with was, to what extent does using person-centered planning strategies improve outcomes? And are those strategies being implemented in culturally competent ways? So this is something we need more research on. The fourth question we came up with is studying alternative housing models, which could include shared living or intentional communities, and learning more about, do they improve outcomes, or vice versa, do they increase or racial ethnic disparities? So it's something we need to study more. And lastly, what is the impact of evolving Medicaid funding models on access, outcomes, and disparities? And by this, we mean things like whether states are, how they're designing their systems, whether they're using waivers or state plan authorities, and whether they're using managed care or fee for service. So that's what we came up with, but I really want to emphasize that we're really at the early stages of understanding disparities for people with intellectual disabilities who are racial ethnic minorities. And it's important, as we move forward, to just really critically reflect on why that is the case. So I think we need to ask some really tough questions about who is conducting the research, who's informing the research questions. Are we mentoring or building the next generation of future researchers? And does that include people from marginalized communities and people with disabilities? Are we really engaging with communities, and how are we doing that to translate our research into practice? So these are questions I think we need to really grapple with as we move forward. We really need to proceed intentionally as we move forward to sort of dismantle some of these structural barriers in our work.